Welcome to the Agility in Real Life podcast, Take 5 in Real Life. Now your hosts, Mike Studeman, Jeff Lee, and Pat Campbell.
Hello and welcome back to the Agility IRL podcast, Take 5 IRL. I'm Jeff Lee, a partner at Agility IRL and one of your hosts.
And I'm Mike Studeman, another partner at Agility IRL, and happy to be partnering with you, Jeff, on this episode of the podcast.
Yeah, it's been a little while since the two of us have done one of these. So good to be back and great time too, because you and I are both working on a couple of different clients and doing similar things with different approaches. And so I think it'll be interesting for people to see how different medical device companies are approaching implementing Agile and Scrum in their processes and different ways of doing it, different pros and cons of those approaches.
Yeah, so obviously we're going to not disclose our clients to our vast audience for our podcast here. So we're speaking anonymously. But what I thought we'd do is just kind of walk through some of the key differences between the two clients and give our 2 cents or cent and a half, depending upon your opinion, on why they made the decisions that they did and how those decisions are working out for them. So let's maybe start with sprint duration. Um, your client, maybe we'll call them client A, and I'll be client B. What's client A doing sprint duration wise?
Yeah, so and I'm going to take one step back here as we get into it, right? Because they both of these clients happen to have been using Scrum before we got involved, but they were having some trouble. And their trouble was typical of what we see with our med device clients, where they were deferring too much work to the end. So they would get to code complete, right, after months of work, and all they have to do is approve the documents and run one more round of testing. And that process takes about as long as the development does because of all the surprises and things that weren't done up front. And so just to give that little bit of perspective, for both of these clients, one of the big pieces of advice we gave is to take a lot of those activities and shift them earlier in the cycle. And so, part of that is the documentation, different parts we'll get into that. But with that as a backdrop, the team or the client that I'm working with, was that A or B? I can't
I
remember.
gave you A, I
All
think.
right. So client A, they were doing 2 week sprints. Before we got there, they are continuing to do 2 week sprints, but they're doing more things in those sprints. More things meaning getting documents updated, getting sign-offs on those documents, a lot of those activities. And so their approach was to actually take on fewer backlog items, fewer story points for those of you who use story points in a sprint, and really get further along in getting things done so they're not deferring it to the end. But their approach was to keep the sprint duration the same, but just taking on less work so they could get more done. You want to talk about client B?
Yeah, so client B is doing a 3 week sprint, but they're actually trying to get all of their regulatory documentation done within the 3 weeks. Now, for our fellow Agilists who are listening in, they're going to want to mute this part of the podcast. So full disclosure, parental warning here. In order to do that, they actually have to put a code freeze in those 3 weeks to do their formal testing.
I
Now,
think we just lost a lot of our listeners.
we did, and know that both everyone know that both Jeff and I kind of cringe when we say that. You probably saw that in my face when I brought it up, but it's much better than what they were doing in terms of that goal of shifting left. And I'm glad that you set that context because I think this pulls out kind of a key point for our listeners here. Oftentimes, people assume that the development of the product, if it's a software product, cutting the code is the critical path. In med device, it's rarely the critical path. The critical
Mhm.
path is all those other documents. So client B, 3 week sprints, it's really 2 weeks of development, a freeze, and then 1 week of testing, which we understand that's waterfall. You can put your comments on the episode below, but we understand that. But it is an improvement from where they were and having all that regulatory document. being pushed out. Now, before we move on from this topic of sprint duration, Jeff, let me bring up a question for you that client B, a member of client B's organization asked, and I don't have a good answer to this. I'll see if you have a good answer to this. Is it possible for a med device product development team to do anything shorter than a 2 week sprint?
For teams that are doing significant efforts, I haven't seen that be successful. Because of the amount of things that need to be done, right? If you're deferring the documentation, that part that's on the critical path, and the reason we say it's on the critical path is because that's the part that gets you approved and gets your product to market, right? You're gonna get done with your developments, even if you run late. But if your documents aren't in a row and or you don't follow your process appropriately, the FDA can just say, no, you're not going to market, right?
Can't
And
sell
you're
it.
done.
Can't sell it.
Can't
Yeah.
sell it. And so that is the critical path. So, knowing that and knowing that if you're really working in, you can do 1 week sprints where you're just developing and testing and deferring all this stuff to the end. It's not effective. Uh, but if you're really trying to get things done, work in an agile way and considering the documentation as part of your product, then I've not seen a 1 week sprint be effective.
Yeah, my answer when the person asked it live was theoretically you can do a 1 week sprint. Theoretically, I could star in an action movie that Brad Pitt starred in, right? I don't think it's going to happen. Um,
I'd like to see that though.
yeah, no, you wouldn't actually.
I just saw F1. I think you'd be great.
Yeah. Boy, I think we've really lost the remainder of our listeners at this point. But in all seriousness, I think your point's well stated in that could you do a 1 week sprint and get software done or a product done? Sure, but if the product is defined to include the documents, and I think it has to be defined to include the documents in an FDA regulated space or a
Mhm.
regulated space more generally, I don't think you're going to get anything meaningful unless you're okay with kicking all that work down the road.
Yeah. Yeah, I agree with that. And so I want to come back to so you mentioned that you're running these mini waterfalls with the code freeze and getting what some clients refer to as a formal testing run every sprint, right? And before we say if it's agile or not, right? What is the idea with being agile? It's being adaptive to change. And if you can get something to done every 3 weeks and be ready to do whatever's next on the board, that sounds pretty agile to me in a med device industry. So I'm going to defend your client B here with that approach if it's working for them.
Well, and it's so I think that's you've hit on a key thing that I think has held what I'll call the large A agile industry back. Well, it's not the way Scrum laid it out, therefore it's not agile, or it's not the way my chosen framework laid it out, therefore it's not agile. This client B is getting tremendous value from this approach. Now, can they make it better? Absolutely. Could we get to a point where we don't need as formal a freeze? Absolutely. We're going to try to help them with that.
Mhm.
But I don't think it'll ever be as easy as a non-regulated website where you can create an item in the morning, test it over lunch, and deploy it in the afternoon. I just don't think that's going to work for that domain, and that's okay.
Yeah. 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 And so I want to, compare that to client A and how they are implementing things because they've also tried to get the people who approve documents, their quality group, and for those of you who aren't in the industry, not thinking about quality from the people who execute tests, right? You have we often call that the verification group, talking the quality process people, the ones who make sure that we're following the rules that we told the FDA we're going to do, the rules we create ourselves to meet regulations. So we are with client A working on getting that quality group incorporated into the 2 week sprint and having their review be part of what we do in that 2 week sprint, which is great as long as you can get the people's time, right?
So what
And
you're saying is they actually have to be present. That's kind of a key takeaway for our listeners, you know.
They do have to be present. And we've seen this before, right? When you introduce something like this to a client, that quality group is usually preoccupied with the project that was developed 6 months ago that hasn't gotten in the hands of the FDA yet, right? And so that's a higher priority than the project that's currently under development that's not going to go to the FDA for a number of months yet. And so, but getting them involved in the sprint to review things right when they're ready it's a struggle. We're seeing some success there, but we're usually not to the point where we get to that end of the sprint and we have all of that work done. We have some of it done, some of it is lagging a little bit. I think, like you mentioned before, right? It's something we're working on, where we don't expect perfection as you're learning a new way of working. It takes a little bit of time.
Yeah, and I think the point that you're making with client A here is that moving quality for one product development, moving them into the actual sprint is going to be it's valuable, but it's going to be hard unless there isn't whole system change because
Hmm.
of all their other waterfall based efforts outside of your effort
Yep.
and them having to kind of eat that long tail of all that documentation that comes out of the non-agile efforts. But it is a step towards success.
Yeah.
And so include them.
Definitely agree. And so we've outlined a couple of different ways of doing it for our listeners. Mike, which one is right?
Yes. Yeah, I think the key takeaway I would have our listeners get from this episode is a couple things. One, as I said earlier, your point is key. Don't always assume that development is the bottleneck. Particularly in med device, it's probably going to be something other than development, however you define development. Two, look for ways to iterate towards success. And I think both client A and client B here are moving closer to an ideal model. They would hopefully agree that they're not there. We certainly feel they're not there, but it's better than it was.
Yep.
Three, don't be afraid to say it's okay for now, or yes, and you need to, but move it forward.
Hmm. Yeah, absolutely. That's a good summary for this episode. So, for those of you who are not in the med device industry and you've made it this far, good for you. Hopefully, you've learned something new. For those of you in the industry, hopefully, some of this is useful to you and gives you some ideas on things that you can try out in your teams and organizations.
Yeah, certainly reach out if you have questions. Love the industry. Love to talk about this stuff. Thanks for hosting, Jeff.
All right. Thanks for joining, everyone. Thank you for joining us on this episode of the Take 5 IRL podcast. If you like it, please go ahead and share it with someone, as well as like and subscribe on your favorite podcast platform. We are available on Apple Podcasts, Spotify, and YouTube. Also, leave us a comment or a suggestion for a future episode. Again, thanks for listening, and we look forward to you joining us next time on the Take 5 IRL podcast.